in Malaysia. In 2008, I started to venture into pharmaceutical industry and become a hospital pharmacist. Although I was born in poor family background, but I believe professionalism and creativity are the key factors to succeed. In my career journey, I found out that in Malaysia and Southeast Asia, we are lacking of a series of best ingredients and well-researched health supplements. Finally, with my persistency, in year 2018, I have successfully collaborated with world top-rated researchers to formulate a series of self-invented and patented formula. Our scientist partners, including the Southern Hemisphere's largest health product researcher, Alpha Laboratories from New Zealand, and the Belgium Research House from University of Leeds Bioextract. This series of health supplements help to solve several important medical problems, including the poor digestive problems, weak immune system in children, and joint arthritis in elderly. With our discovery with the scientists across the globe, our products have been able to reduce the sufferings and medical costs in Malaysians. We market our products and have strong partnership with 250 pharmacy outlets in Malaysia. I lead my team to provide them complementary training, including entrepreneurship, leadership, and soft skills to build their business. Besides that, we collaborated with 10 top-rated universities to inspire more than 3,000 pharmacist undergraduates in Malaysia to serve with great passion to the community that we love. During COVID-19 pandemic, I collaborated with hospitals to organize blood donation campaign to cope with severe shortage of blood to the community. We donate 40,000 worth health supplements to enhance medical frontliners' immune system and to donate PPE, gloves to Hospital Sungai Buloh. We hope to become the driver of healthy lifestyle in the communities that we serve. In the past, we are so honored to win a few important awards, this including JCI CYEA Top 30 and the Star Soba Rising Star. I strive to invent more products to fight against various diseases using natural remedies. I wish my innovative work to advance the future of the medical world and have broad impact to doctors, pharmacists, and patients around the world.
Selamat petang dan salam sejahtera. Saya ingin memperkenalkan diri saya. Nama saya Eng Kabun, selaku penorong pengalah latihan Persatuan Bulan Sabit Merah Malaysia, Negeri Pulau Pinang. Pihak majlis mengucapkan terima kasih dan mengalu-alukan kehadiran pelajar-pelajar, guru-guru dari sekolah seluruh negeri Pulau Pinang yang menyertai ceramah. 29 September setiap tahun adalah Hari Jantung Sedunia. Sempena Hari Jantung Sedunia, pihak Persatuan Bulan Sabit Merah Malaysia, Negeri Pulau Pinang, Jabatan Pendidikan Negeri Pulau Pinang dengan kerjasama Excel Live menganjurkan ceramah secara maya bagi semua guru dan murid di Negeri Pulau Pinang. Tajuk ceramah pada hari ini ialah Sudden Cardiac Arrest. The World Heart Federation menyuruh orang ramai supaya menggunakan rangkaian digital yang sedia ada pada masa ini untuk menghubungkan pesakit dengan keluarga, rakan, pesakit lain, doktor dan penjaga, terutama semasa menghadapi situasi wabak COVID-19 pada masa ini. Jangan biar diri sendiri atau keluarga merasa terpencil atau sendirian. Gunakan teknologi untuk berhubung serta bagi membantu dalam penjagaan kesihatan hati dan jantung anda. Hashtag gunakan jantung heart untuk berhubung. Hashtag use heart to connect. Ini adalah slogan tahun ini. Hadirin yang dimuliakan, sebelum tirai ceramah dibuka, sebelum kursus bermula, suka saya membacakan biodata penceramah kita pada hari ini. Dr. Tan Kok Ling. Beliau mempunyai ijazah perubatan di USM pada tahun 2006. Kemudian beliau melanjutkan pelajaran Master in Internal Medicine USM tahun 2015 dan sambung pengkhususan dalam Fellow Cardiology Universiti Malaya 2021. Dan kini menjawat jawatan sebagai pencara kanan dan pakar kardiologi di USM Pulau Pinang. Dr. Tan merupakan ahli Malaysia Medical Association, ahli National Specialist Registrar Malaysia dan ahli National Heart Association of Malaysia dan lembaga penyunting Editor Board International Journal of Cardiology and Research, SIGDOC Publisher USA. Beliau sememangnya arif dan berpengetahuan luas dalam perubatan kardiologi dan selalu dijemput untuk memberikan ceramah dalam negara maupun di peringkat antarabangsa. Dr. Tan mendapat anugerah Heartfield Research Award pada tahun 2019. Tanpa membuang masa lagi, majlis dengan segala hormatnya mempersilakan Dr. Tan untuk menyampaikan ceramah. Dr. Tan, the floor is yours. Thank you.
Okay, thank you very much. I'm your cardiologist of the day today. Allow me to use English for today's presentation. So, thank you, Mr. Eng, for setting up the stage for me. And of course, today we would like to thank Excel Live, Persatuan Bulan Sabit Merah Negeri Pulau Pinang, and also the Pasukan Badan Beruniform Jabatan Pendidikan Negeri Pulau Pinang. So for today, the topic given to me is sudden cardiac arrest. So for within this 1 hour presentation, I'm going to talk about the definition of cardiac arrest. I'm going to cover a little bit on the statistic and the change of survival. And I also want to teach a little bit on how to do CPR and also how to use the AED machine. So now I'm going to share my screen. And okay. All right. So without further ado, we're going to start our presentation of the day today. So today we're going to talk about sudden cardiac arrest, okay? So now we talk about a little bit on the definition of cardiac arrest. So what is cardiac arrest? Cardiac arrest is a life-threatening emergency that occurs when the heart suddenly stops beating. So it can happen to everyone, including you and me, irregardless the age and gender. So this is a condition usually result from a problem with the heart electrical system. So let us imagine our heart is a factory. Our heart is a factory that pumping, sending the blood to all parts of our body. So electrical system is the electricity supplying the factory. So we imagine like that. So cardiac arrest is something happen to the electrical system. Cardiac arrest isn't the same as the heart attack, because in heart attack, the heart is still pumping. However, the blood flow is limited in the heart attack. So, however, the heart attack can also trigger electrical disturbances and subsequently lead to cardiac arrest. So, most of the cases of cardiac arrest happen in home and also the workplace. It takes about 2/3 or 80% of the cases, and the rest happen in the hospitals. So when cardiac arrest happen, the victim collapse, drop on the floor, and does not respond and do not breathe normally. They will seem having seizure, shaking the whole body, and the cardiac arrest will lead to death in minutes if the patient does not get any help right away. So let us look at the graph. So you can see the horizontal axis indicate the timing in minutes, and then the y-axis indicate the chances of survival. So you can see the chances of survival reduce rapidly up to 10% for every minute delaying in doing CPR. So now you know that the time is very important in increasing the chance of survival. Survival is possible with a fast reaction from all of us. Chest compression and using a defibrillator can improve the chance of survival until the emergency worker arrives. CPR plays an important part by sending the oxygenated blood to the brain and the rest of the body. So cardiac arrest can happen without any warning. It happens very fast. The victim will suddenly collapse, drop to the floor, loss of consciousness, no pulse, and no breathing. But sometimes they do complain of some uneasiness, such as chest discomfort or chest pain, shortness of breath, difficult in breathing, palpitation when the heart beats very fast, or they feel dizziness. So what is the cause of cardiac arrest? Like I said, most of the time, the cardiac arrest happens by disturbance in the heart electricity. But sometimes it will happen in sudden heart attack, food or drug poisoning, traumatic injury, or anaphylaxis. It's like a very severe allergic reaction. So we're going to talk in detail for each of all the causes. So the first most common is electricity abnormality. We say that when the heart having an abnormal rhythm, in medical terms we call it arrhythmia. It happens when the heart electrical system doesn't work properly. Like I said, for the example just now, when the electrical system doesn't work properly, the factory of the heart cease to function. So this is what we call cardiac arrest. We need a normal electrical system to control our heart rate and also our heart rhythm. So a little diagram to show you how's our heart electrical system look like. So focus on the green color drawing. So normally our heart will receive a generation of electrical system from the top of our heart. So the electrical system will flow through the green pathway to spread to the whole heart. And under a normal situation, our heart will beating normally. But what happens in cardiac arrhythmia or during abnormal heartbeat? The electrical system start firing from the ventricle. Okay. So when the abnormal rhythm firing from the lower ventricle, the most dangerous situation, we have two. One is called ventricular fibrillation, another one is ventricular tachycardia. So you all no need to worry about the medical terms here, but I will show you how they look like. In a normal heart rhythm, when you look at the cardiac monitoring, it will look something like this. This is a normal heartbeat, normal heart rhythm. All right, so now you can appreciate how the normal rhythm look like. I'm going to show you the abnormal one. So this is when our heart goes into abnormal rhythm, ventricular tachycardia look like. So now you can appreciate it. It's more chaotic and it's more faster. During this situation, our heart cannot pump like normal. This is ventricular tachycardia. And how about ventricular fibrillation? This is how ventricular fibrillation look like. All right. So you can see only electrical activity, but the heart doesn't beat at all. When the heart doesn't beat, meaning there's no blood supply to the vital organs of our body. The most vital organ in our body will be our brain itself. So in summary, so you can appreciate much more better when you compare side by side how the normal rhythm look like and what the ventricular tachycardia and ventricular fibrillation look like. So what is the other condition can contribute to the cardiac arrest? We have coronary artery disease. So what is coronary artery disease means? Our heart got the blood supply system. So that's what we call artery system in our heart, coronary artery. So when the coronary artery get clogged or obstructed inside by the cholesterol, that will cause reducing the blood flow to the rest of the heart. And this is what we call coronary artery disease. When the situation becomes so severe, the heart muscle doesn't get enough blood supply, then you will have heart attack. And heart attack is a very dangerous thing. It can happen within several hours, and that will cause our heart muscle to die and leaving a scar tissue. And that scar tissue is not good to conduct a normal electrical activity. So a little bit diagram to show that, not to be confused, our coronary artery subsystem, not to be confused with the electrical system I showed you just now. So this mainly is the blood supply system. So from here, you can see that in a normal coronary artery, it shouldn't have any cholesterol deposit inside. But when coronary artery disease happen, you will have a narrowing. You can see the diameter of the internal lumen become limited due to the cholesterol deposition inside the coronary artery disease. And this will limit the blood supply to the heart. So other conditions that can contribute to the cardiac arrest, you will have enlarged heart. The heart muscle becomes so enlarged, so huge, so muscular. And this is a situation due to the prolonged hypertension. So we know that hypertension, darah tinggi, is very common in our community. And most of the patients, they do not comply to the medication. So under that kind of hypertension condition, our heart become muscular. So a muscular heart is not good, and it will contribute to the cardiac arrest. So what is valvular heart disease? Valvular heart disease in Malay is injak jantung, masalah injak jantung. So that can happen in a few situations. So we're not going to talk in detail about the valvular heart disease here. And another condition will be the congenital heart disease, which will be a jantung berlubang in simple way. So what is the risk factor for cardiac arrest? So we know that coronary artery disease can contribute to cardiac arrest. So most of the risk factor for coronary artery disease will be the same risk factor for cardiac arrest. So mainly genetic, family history, smoking, high blood pressure, hypertension, high blood cholesterol, obesity, diabetes, kencing manis, sedentary lifestyle, and a previous past medical record of heart attack due to old age or use of illegal drug such as cocaine, amphetamine, or nutritional imbalance or kidney disease. So a little bit on the statistic. So I quote Malaysian statistic 2017. We roughly recorded 37 deaths daily due to sudden death. So most of the risk factors contribute to the sudden death in Malaysia are obesity, hypertension, diabetes, and smoking. So in Malaysia, the chances of survival of cardiac arrest is less than 1%. Whereas in other countries, the life expectancy can estimate around 25%. The differences in the percentage is mainly contribute to the number of CPR provider in the community, as well as the number of AED2 device available in the community. So I want to highlight is less than 5% survival without early CPR, without early defibrillation. Defibrillation within the first few minutes of cardiac arrest can increase the chances of survival from 5% to over 70%. So learning to do a CPR and also to use an AED machine is very important. So when we talk about CPR, we need to mention the change of survival. So what is change of survival? It mainly consists of 4 important steps. The first step will be early recognition and call for help, followed by early CPR. The third important step will be early defibrillation or use AED machine. And then followed by the hospital care, post-resuscitation care. So from here, you can notice that in the change of survival, the first 3 steps can be conducted by the layman, that means by you and me. So what is CPR? CPR, the full words will be the cardiopulmonary resuscitation. So it's an emergency life-saving procedure performed when you encounter a cardiac arrest victim. So why we need CPR? Because due to our body cells require oxygen to survive, so our body carry oxygen and nutrient pumped by our heart. So when the heart go into cardiac arrest, the heart will stop sending the blood to all these vital organs. So without the supply of oxygen to our body cell, they will slowly to die. So talk about the brain tissue. Within 4 to 5 minutes without oxygen, the brain cells will begin to die, and this will lead to permanent brain damage and also the brain death. So the purpose of doing CPR is to keep the oxygenated blood flowing around the body while waiting for the AED or medical personnel to arrive. So how to do a CPR? I have a very interesting mnemonic here. So if you are new to CPR, if you are totally no encounter to any lesson for the CPR, I have a mnemonic giving to you today. So it's called Dr. ABC or Dr. ABC. So what is the first word, capital letter D, is to assess the danger, followed by respond. And then the ABC will be the airway, breathing, and compression. So I will go into detail into this Dr. ABC later. So now, when we talk about CPR, we contain of compression and also ventilation. CPR, usually we will do 30 chest compression followed by 2 rescue breaths. To do a CPR later on, I will show you all the much more detailed photograph to show you. But now I'm going very briefly how we do the CPR. First, we start by interlocking our hands and place them in the middle part of the victim chest and push down for 30 times. For the rate, it takes about 100 chest compression per minute. And after every 30 chest compression, we will give 2 rescue breaths. So this is what we call 32 cycle. So can we stop CPR? Yes, sometimes we can stop CPR if the casualty show signs of life. The casualty revive, start to cough, start to breathe. In that situation, we are allowed to stop our CPR. Or the AED device arrive and is about to use, we can temporarily stop our CPR as well. Or the ambulance service arrive and you are asked to stop by a healthcare profession to stop the CPR, or you become too exhausted, or the situation becomes too dangerous for you to continue CPR. So now, because of the COVID-19 pandemic, we are facing a new dilemma here. about a 32 compression ventilation CPR. So I probably will talk about the new thing here. It's called continuous chest compression. It means that we only do a pure chest compression continuously without a mouth-to-mouth breath. So it's mainly due to these changes is mainly due to the COVID-19 pandemic. Study also show that less people tend to offer the CPR when rescue breath is needed, and this hesitation causes CPR delay. What they are concerned is mouth-to-mouth, the hygiene concern. Some of them worry about the legal consequences, and some of them just simply don't know how to perform normally. They do not know how to seal the victim mouth properly. So the solution will be the chest compression only, or use a plastic oral device. So this is how the plastic oral device look like. So it's either you carry on on your body every time, or it's just improvise. However, the conventional CPR compression ventilation is still the best for the victim of drowning, because all the drowning victims, the main reason of them cardiac arrest is due to lack of oxygen. So CPR chest compression is still the best in this group of victims. So we've talked a little bit about the AED. AED, the full terms is automated external defib, used by the lay rescuer. So we can see that from the change of survival, AED is at the third step. So now we look at these two photos. This is a normal defibrillation machine that you can find in hospital. And this is an AED machine that you can find in most of the public area like airport or some shopping mall. So look at their differences. The hospital defibrillation machine is more bulky, and it contains of certain metallic pedal, and is not portable. Whereas those AED machine that you can find in airport and shopping mall is much more smaller, user friendly, and mainly small and portable. So the chances of surviving without CPR, without AED is less than 5%. So if we can use a CPR and AED machine within the first 5 minutes, the chances of survival is increased more than 70%. So using AED machine is safe and simple. And what is the AED function? When we do a CPR, sometimes the patient heart rhythm still abnormal. We need an AED machine to reset the heart rhythm. So meaning to say that AED machine is a device to reset, to jumpstart the patient heart beat. But AED machine can only jumpstart when they encounter a shockable rhythm. So what is shockable rhythm? Shockable rhythm is the abnormal rhythm just now I showed you all. It's a ventricular fibrillation or ventricular tachycardia. And nowadays, the AED machine is very user-friendly. It gives audible and visible prompt and guide to us how to use it. So AED machine will keep on telling you what to do next. Sometimes they will tell you, do not touch the patient because the AED machine is analyzing the heartbeat. The AED machine will advise you to shock it by pressing the shock button, or the AED machine will tell you to continue doing CPR. So this is how you should place the AED machine. So there's two placements here. First, you need to place on the right upper part of your chest wall, and then the other one at the left lower part. So you follow the voice machine, and then the button is also simple. You only need to follow the advice. So again, I want to emphasize, without CPR, the survival rate is less than 5%. CPR only, the survival rate will increase about 2 to 3 times the chances. And combination between the CPR and AED machine, the chances of survival will increase more than 70%. So this is a universal symbol of AED. So they all look the same. So you only need to pay attention in the shopping mall, pay attention in the airport. So they also have different style, different company supply, but they are actually function the same way. So AED machine will not shock a normal functioning heart. AED machine will not shock a heart that completely stopped. And AED machine will only shock if they encounter a shockable rhythm, which are ventricular tachycardia and ventricular fibrillation. So how to use an AED machine? First, you need to turn on the machine. And the AED machine can turn on either automatically after you opening the cover, or you need to press the on button. Second, you need to expose the victim chest. You open the shirt, or sometimes you might need to cut open the shirt. Make sure the chest is clean and dry. CPR still need to ongoing, so you might need a second hand to help you. After that, you remove the pad from the AED packet, and then you attach the pad according to the location indicated by the pad itself. One is the right upper part, another one will be the left lower. You might need to connect the pad to the AED machine, and there will be a flashing light for you to connect the socket. After you connect it, everything, the AED machine will ask you to stop CPR because the AED machine will start to analyze the rhythm. So in this moment, you need to shout, everybody stay clear, to allow the AED machine to analyze the heart rhythm. So if there's a shockable rhythm, the AED machine will advise you to press the shock button to deliver a shock. If there's no shock advice, then the AED machine will ask you to continue CPR. So how to deliver a shock? So you only need to press the button. After deliver the shock, continue doing CPR. So do not stop CPR more than 10 seconds. Continue doing CPR. Do not turn off the AED machine because the AED machine will continue monitoring the heart rhythm. So continue CPR until every 2 minutes. The AED machine will advise you to stop for a while so that the AED machine can monitor or analyze the rhythm again. So continue doing all this cycle until the ambulance arrives. So there will be a certain condition. In all these certain conditions that I might need to advise you how to encounter them. So in children, can you use AED machine in children? So yes, AED machine can use on children, even they are less than 8 years old or less than 25 kg. In certain AED machines, sometimes they contain the child pediatric pad. And the place that for you to put on the pad will be one at the front and the other one at the back. Okay? If you found none of the pediatric pads available, then no choice, you still can use the adult pad. So how about the wet victims? Sometimes cardiac arrest happen in the swimming pool. You need to first remove the victim from the water or any wet surface. Dry the victim chest, only the upper torso, before applying the AED pads. So the rest of the victim do not need to clean entirely. You only need to make sure the chest is totally clean. So sometimes you might encounter a hairy chest wall victims, and in this situation, the AED pads will not stick properly and sometimes they do not analyze properly in such hairy condition. So good thing is most of the AED accessory kit inside, you will see a scissor and also a razor. You can use the razor to shave off the area that you need to attach the pad. Then only you put on the pad. How about in the female victims? They having wearing bras. You need to use the scissor to cut open before you apply the AED pads. So how about the jewelries? So this one you only need to push aside. You no need to remove them. So just make sure there's no contact between the jewelries and then with the AED pads. Do not waste time to remove them. So sometimes you will encounter a patient with the so-called implantable device. So what is implantable device? This is a pacemaker or defibrillator. It's used to regulate the patient heart rhythm. So the patient have a minor surgery done before where the cardiologist inserted this device into the patient chest wall. So you will see there will be a device underneath the skin in the upper part. So you need to avoid putting your AED pad on top of this one. So you can put the AED pad just 1 inch, about 2 centimeter, about 4 centimeter also can below the device. Do not put the pads directly on top of this device. So how about transdermal patch? Certain patients, they apply some medication and then this medication also you need to remove and make sure the skin is totally clean before you putting a AED pads. Okay. So metal surface, of course, if the patient lying on the metal surface, you need to remove them because the metal surface might shock you if you are too close with the metal surface. Okay. So again, I want to emphasize the survival rate will reduce when you're delaying in using the AED machine. So all of us need to learn how to use an AED machine and take all the precautions that I mentioned just now in the special circumstances, and you know it well, and then start learning today how to use an AED machine. So, okay. So out of hospital cardiac arrest is what I'm talking about just now. So probably I'm not going to repeat all of them. So like I said, most of the cardiac arrest happen in the home, about 80%. And then the bystander CPR is very important while waiting for the ambulance to arrive, all right? So the chances of receiving the bystander CPR, of course, different amongst the country and location. Okay, I'm going to talk about very fast here, all right? So the change of survival, like I mentioned just now, is contained of 4 important steps. The first 3 steps is very important and can be done by you and me. Okay, the first 3 steps is very important. So, if you do it well, the victim survive, then all the victim will send to hospital. What the doctor will do next? The doctor in the hospital will try to identify what is the cause of the cardiac arrest. And then after we knowing all the cause, we try to prevent it for the future occurrence. So in the hospital, we will order several tests to find out what is the underlying causes. So we can done ECG, blood test, X-ray, echocardiogram, CT scan, or coronary catheterization. So probably I go a little bit in the simple way so you know what is actually happening. What is ECG? ECG is look like this one. So surviving cardiac arrest victim will send to hospital, and then we will do the ECG for them. So this ECG will tell us what is actually happening to the electrical system of the victim. So what is echo? Bedside echo. Echo is the ultrasound. We do it bedside. We can use the ultrasound machine to look inside so we can know what is actually happened to the heart muscle. Okay. So long-term treatment, again, we will discuss with the victims what is the best treatment, and how to reduce the future chances of develop cardiac arrest. And then we will start giving them medication to control the heart rhythm to prevent any future cardiac arrest. And again, we might offer them a cardiac device. This is the thing that I showed you just now that we implanted. It's a minor procedure. We implanted below the skin, and this device will go into the patient heart. So this device will constantly monitoring the cardiac rhythm, and it will deliver the shock when the patient go to the cardiac arrest. So this is look like a very life-saving device. All right. So this is the thing that sometimes we will offer the patient for all the cardiac arrest victim who survive throughout the hospital stay. All right. Of course, we will sometimes, if the situation is needed, we will carry on with the cardiac angioplasty. This is what in Malay we call putting a stent, okay, inside the heart vessel. All right. Sometimes you might need to do surgery. Okay, this is how the things look like in the hospital. Okay, so all the advice you need to give, healthy lifestyle advice you need to give to all of us, to victim. Do not smoke, maintain the healthy body weight, take a low salt, low sugar, because consume high sugar, consume high salt will contribute to hypertension and diabetes mellitus. And always stay physically active, do regular exercise, and then manage your mental stress. Okay, so this is the overall the discussion on what is cardiac arrest. Okay, the statistic, what is the definition of cardiac arrest, and how to do a CPR in brief. But now, I think I still have about 20 minutes. I can show you in detail how to do a proper CPR. All right. So today I'm going to talk about the basic life support in adult first. Okay, I'm going to talk about in adult. So a little bit statistic. It takes approximately about 8 billion cardiac arrests every year globally. All right. And then the survival to hospital discharge is very low, about 5 to 10% only. That means 10 victims, only 1 survive. If we can do an early CPR, then we will increase the chances double to triple. If we can do CPR plus AED machine, then the chances will increase more than 70%. So again, to emphasize on the change of survival, first, we need to early recognition and call for help. Assess the danger, assess the response, followed by the ABC until the patient survive or until the ambulance service arrive. So every country have a slightly different sequence. So for my presentation today, I'm going to use what our Malaysian suggests. So our Ministry of Health in 2016 come out in the standard guideline how to do a CPR. Okay, so it follows this sequence. You can see that first we need to approach the victim safely. We assess the danger, D, and then we assess the response, R. Then we shout for help. We call ambulance 999. Then only we proceed with ABC, open airway, check the breathing, and also the chest compression. Okay, DR, ABC. So in the end of the presentation, I'm going to show you how the American did do for their change of survival. All right, I will show you the comparison, the differences between Malaysia and American. Both of them are right. You can use any of them, but you only need to familiarize with one. So for today's presentation, I'm going to show you the Malaysian style first. All right. So first, approach the victim safely. You assess the danger. So what kind of thing you need to assess? The scenery, and then the victim, yourself, and also the bystander. So what things that you need to assess? Number one, is there any fluid, blood, any water? Because water can conduct electric. So you need to look out for any water, slippery floor. You also need to watch out for the electric wire, fire, or any sharp object. Okay, these are all the things that you need to focus. Whether there is an unsteady beds or any trolley, and whether you can approach or you can enter the scenery safety without any protection or not. So make sure these are all the things that you need to run in your mind. But of course, before helping people, you must have a very clear and a very calm mindset first yourself, right? Don't panic. After that, check the response. So how are we going to check the response? We shake the victim's shoulder. We shout, "Are you all right?" If the victim responds, so you can ask what is actually going on, and then you need to keep assess regularly. Okay, if the victim respond. So what if they not? Then you need to proceed with the change of survival. So under the by the Malaysian guideline, from here now on, you can call for help. So if you have carry a handphone, then you can press 999. After pressing 999 on the speaker button, because sometimes the response team will advise you what to do next. So you need to on the speaker button so that you can carry on what they advise you on spot, hand-free. All right. So you call 999. So if you are not carrying any handphone, you can shout for help. Hopefully there's any bystander can help you. So ask them to call 999 for you. Ask them to find the AED machine for you, right? Then after that, you follow with the A, B, and C. So A, okay, now position first. So whoever victim that found on the floor should remain managed on the floor. Do not move them unless they are in the swimming pool itself. So you need to remove the victim from the water. Otherwise, lying on floor victim should manage on the floor. Face down victim, you should roll over so that the victim will face up. If the victim are lying on the air-filled mattress, then you need to puncture the mattress so that the mattress is deflated. You do not want to do a CPR on an air-filled mattress, all right? Because it will not be a good quality CPR. So, do you need to find a hard board to put at the patient bed? Or you do not recommend. We do not recommend that. Because finding a bed board is time consuming. To put a victim on the bed board also sometimes it will cause more injury than doing any good. So bed board at the back of victim is not recommended. You open the airway. So how do we open the airway? We use a maneuver called head tilt chin lift. When we use one of our hand palm to put on the forehead, and then the other one hand to lift out the chin. So this is head tilt chin lift. Is a maneuver for healthcare rescuer like you and me. All right. So should we put our finger to swab any oral material? Well, this one I do not advise. We do not need any finger sweeping in the oral mouth, in the mouth cavity, unless you can clearly see the foreign body and then you think that you can take out easily. Then, otherwise, do not do any blind finger sweep. All right. My advice is any ball object, smooth surface object, do not try to remove it because you might pushing deeper the foreign body. So what if there is a chain thing like your jewelry, gold chain? That one you might need, you probably can take out. If there is a tail of any chain that in the mouth, side of the mouth, then probably you can take out. Otherwise, do not try. So for those healthcare professionals, sometimes they will do a maneuver called jaw thrust. They do not perform a head tilt because some of us, we worry that there is a spine injury, especially for those motor vehicle accident victim. We worry that there will be a bone fracture over the neck. So sometimes we will avoid doing a head tilt. Instead of that, we're doing jaw thrust. After that, check the breathing. How are we going to check the breathing? We look, listen, and feel. We look for what? Look for the chest wall to go up and down. We listen to the breath, and then we use our chin or our side of our face to feel for the warmness of the air. Look, listen, and feel for the normal breathing. But do not confuse with agonal breathing. All right? So later on, I will show you what is agonal breathing. Okay? So absence of breathing. Okay? All these assessments should not take more than 10 seconds. And we should commence CPR right away if there is none of the normal breathing. Again, if you're in doubt, all right, just do it. Just do the CPR. If you are in doubt, do not waste your time. All right, more than 10 seconds. So what is agonal breathing? Agonal breathing is not the normal breathing. It's described as very heavy, noisy, gasping for air. So it's a sign of cardiac arrest, and do not mistake it with the normal breathing because that will delay your CPR. Okay. So I will show you a video. So what is agonal breathing look like?
Gasping or agonal breathing is not true breathing. Do not confuse it with normal breathing. The victim is in cardiac arrest.
All right. Suddenly drop. All right. They may have a body shaking, seizure, and this is what we call agonal breathing. All right. This is not normal breathing.
The intervals between breaths get increasingly longer.
Okay. So not to be confused with that. All right. So this is agonal breathing.
Start
CPR.
immediately as if the person was not breathing.
Okay. So to start CPR, like the presentation I showed you just now, commence 32 cycle. All right. Now I'm going to talk about in detail what is the good quality CPR. So just now I did not show you any diagram, and this is a chance for me to show you where you should put your both hands. All right. So first, use one of your palm to put on the center of the chest. Okay, there's a nipple line here. You need to put your palm slightly below the nipple line and then interlocking your finger with another hand. All right, interlocking and then pressing the chest. So how fast you should do the chest compression? You time yourself about 100 beats per minute. As fast as that. You need to make sure the heart press about 100 times per minute. Okay? So the depth, how deep you need to compress is about 5 centimeters. And each compression, you should release fully to allow the chest to fully relax and reduce the interruption. Let's say there's a helper, we're going to put on the AED machine. The interruption should be kept less than 10 seconds. All right. If possible, if you have 2 operators, you can change the CPR, swap the role for every 2 minutes. And then after 30 compression, followed by the rescue breath. So how to do a proper rescue breath? You pinch the victim nose, yourself take a normal breath, seal off the victim mouth by your own lips, and then blow it for 1 second. Allow the chest to go up and then fully recoil later on. Repeat for twice. Then, so how much air you need to blow in? About 500 cc, but in real life, it's probably very hard for you to estimate how much. So roughly take about 1 second breath in, make sure the victim chest go up, then you should be good. So yeah, in a nowadays situation, either you opted for total chest compression alone. I mean, in the current situation of COVID, you can opt just to do a pure CPR, because I believe nowadays in the life, you encounter all the victims should be wearing face masks, and you yourself also wearing face masks everywhere you go. So I think probably it's not wise to remove your face mask and remove the victim face mask and doing the usual CPR 32 in this era. So okay, fine, you can opt for chest compression totally without a ventilation rescue breath. But again, if you carry a protective device such like a plastic mask, then you can do so. Okay, to reduce the uneasiness of the mouth-to-mouth ventilation. So again, continue 32 cycle until the help arrive. All right. If there's 2 rescuer, you can switch the role every 2 minutes. So okay, you continue. So what if the AED arrives? So AED you can find in the shopping mall, airport, right? So probably I can go a little bit faster here. So defibrillate machine, okay, the device will detect a shockable rhythm, and then they will advise you to shock if there's needed. If there's no shock needed, the AED machine will advise you to continue CPR. Okay, so just now I already mentioned how to do a CPR, how to put on the AED machine. Okay, and do not touch the victim because the AED machine do not want any vibration. Okay, try to avoid any vibration while the AED machine is analyzing the heart rhythm. If there is a shock needed, so this is what you should do. You stand clear, you shout loudly, I clear, you clear, everybody clear, then only you press the shock button. Okay, so again, I repeat myself, VT and VF, ventricular tachycardia and fibrillation, is a shockable rhythm. Okay. So after every shock delivery, continue CPR 32. Okay. So continue until when? Until the qualified help arrive, take over, or continue until the victim recover, or you are too exhausted to continue anymore. All right. Do your best. Do your best. So if the victim recover, got breathing, so you roll the patient into a recovery position. So what is recovery position? Recovery position is look like this one. Okay. So if the victim start to breathe normally, but still a little bit dizzy, unconscious, okay, this is the position you need to put them. So a little bit sequence how you roll the victim, put on one hand, one limb, and then the other hand put on this side, and slowly turn the whole body to one side. Okay. So a little bit on choking, probably I need to cover this one also. So choking. So choking, well, there's a 2 condition. One is mild choking, one is very severe. In a choking victim, they still can talk, all right? They can speak, they can breathe. A severe choking usually is very deep. The foreign body go very deep. They're unable to talk. They might only can nod their head. And then sometimes they're unable to cough properly. And then this is a very dangerous situation, all right? So in a mild airway obstruction, where the victim still can cough, all right? Then you stand beside them, encourage them to cough, and then you check their progress from time to time. But what if the obstruction is very deep and very severe? You can do a 5 back blow followed by 5 abdominal thrusts. This is what we call Heimlich maneuver. Later on, I'll show you all. Or if the condition become too severe, the victim become unconscious, then start our CPR. This one I mentioned already, okay? So how to do a back blow? 5 times at the back, 5 times abdominal thrust. So how to do an abdominal thrust? You stand at the victim at the back and then use one palm, hold like this, pressing the abdomen 5 times. So cover a little bit a special condition CPR in infant. So for infant is a baby less than 1 year old, children 1 to 5 years old. So if you are alone, give 5 rescue breaths first before you start commence CPR. So in pediatric, in budak-budak, the CPR we can use 15-2, all right, not 32, it's 15-2. And you must add 5 rescue breaths before you start everything. Why? Because in pediatric population, the main reason they go into cardiac arrest is due to asphyxia. That means the tercet. So lack of oxygen. is mainly an oxygen problem. So providing rescue breath first is very helpful in pediatric group because pediatric hardly have heart problem. So they mainly encounter a breathing problem. So giving a rescue breath first 5 times, then followed by your CPR, and the special CPR is the ratio is 15:2, and then call for help. So the difference between the CPR in pediatric, you only need 2 fingers, all right? Place it in the center of the chest wall, slightly below the nipple line, and then again 15 times plus 2 breath. Okay, how deep you need to press? About 4 centimeter. Try not to press too deep because you might injure the liver, fracture the ribs. So about 4 centimeter, and then the rate also about 100 compression per minute. Okay, and then followed by your rescue breath, 15:2. For a bigger pediatric or bigger kids, children, you can put your whole palm on top of the chest wall, also below the nipple line, and then press about 5 centimeter, about 100 compression per minute. Again, you only need to press 15:2, 15:2, 15:2. All right. So a little bit consideration. So can we break the victim chest wall? Oh, yes. Study have shown that that can happen, but the fracture did not cause any serious bleeding or cause any death. So the chances of surviving a cardiac arrest is almost 0 if you refuse to do CPR. So do CPR. We know, keep in mind, fracture can happen, but our purpose is try to rescue life here. All right. So if we are getting too tired before any help arrives, what I should do? So continue provide a hard and fast chest compression with minimal interruption, the best you can. We know that CPR is a very tiring job. Most of the adult will get tired very fast. Okay. So if you got helper, ask them to help take over. If you are purely alone, then just do your best. Okay, just do your best. If you're getting tired, you cannot carry on, it's fine. Just do your best. So the whole presentation I quote from the Malaysian guideline 2016. So I give you the link here, so you all can open yourself to read yourself, also counter check from time to time. All right. So a little bit more time, I'm going to compare Malaysian guideline and American. So what is the difference? So this is the summary of the American good quality CPR. So first, they also assess the danger. Okay, verify the scenery is safe, assess the danger. Second, they will also follow R, recognizing and respond. They will check the response, but they will also check breathing. They will also check pulse. And if there's no pulse, there's no breathing, then they will call telephone. They will call for emergency. So this is a slight different. Our Malaysian DR ABC, but the American they DR check airway, breathing, pulse, then only followed by the two. So that's a slightly different. So no wrong. You only need to do memorize one, and be excellent of one is good enough. All right. So should you do a pulse checking? So for a lay person, so probably you might have difficulty to feel pulse. So either in the carotid pulse or the radial pulse, sometimes you might take more than 10 seconds to assess the pulse. So if you are not familiar, you can totally ignore the pulse access. Just check breathing. Okay, look, listen, and feel for a normal breathing is much more convenient for a lay person. Okay. So that's the reason why in Malaysia, we do not emphasize pulse checking. But if you're familiar, fine, go ahead. But if you're not familiar, take more than 10 seconds, forget pulse, okay? Just check for the breathing. So this is the sequence difference between American and Malaysian. Okay, otherwise, everything's still same. If you have handphone, call handphone 999 and put on the speaker mode. If you have 2 rescuer, then do. So there's also a slightly different. Again, for adult, there's no difference. 32, 32, 32. Either you are alone or there are 2 rescuers. In Malaysia, same 32. American also same 32. But for pediatric age group, Malaysian, we advise you to do the 15-2 sequence, okay? Either you are alone or you are two rescuer, you just follow 15-2. There's the difference, slightly differences in American. If they are one rescuer, they follow 32. If they are two rescuer, they follow 15-2. So there's a slight difference between Malaysian and American, but no wrong. But for pediatric age group, why we emphasize more breathing, more shorter cycle and more breathing. Like I said, most of the pediatric, they suffocate, they cardiac arrest due to asphyxia, lack of oxygen. So by doing a 15-2 sequence, we can give more air puff, much more regular. So this is our rationale for our Malaysian guideline, okay? But no wrong. Otherwise, everything still same. The compression, Malaysian, American, about 100 beats. Okay, everything still same. The depth, about 5 centimeter. For pediatric age group, about 4 centimeter. Okay, so everything still same. You are still allowed the full recoil, and then minimize the interruption, less than 10 seconds, everything still same. So with it, I think that's all for my presentation. Thank you. So any question can ask me.
Soalan ni. Okay, thank you for Dr. Tan. Kalau ada apa-apa soalan boleh kemukakan dan saya akan tanya pada doktor. Okay, Dr. Tan, I have one question. Commonly, people saying that during pandemic COVID-19, now we are wearing masks. Maybe the casualty also wearing masks. So most probably we doing a hands-only CPR, continuous chest compression. So without ventilation, does it effective and why?
So of course, there will be a quality comparison. Of course, the quality will be lesser compared to the conventional CPR 32. That will be a much more better quality because we constantly giving the oxygen to the victim. So a pure chest compression CPR, no doubt, by comparison, the quality lesser. But in this situation, it will solely depend on the rescuer, whether they are how keen for them to provide the CPR themselves. So again, CPR is a volunteer, so by no force, so it's up to them for decide. But to be honest, the quality for chest compression only is lower compared to the conventional CPR. This one we have to keep in our mind. So it's the rescuer provider to judge themselves how far they want to provide the help.
Okay, thank you, doctor. So regarding the implants pacemaker that you are showing just now on the photo, because on the left hand side, so we place the pad on the upright, so I think there's no problem. But what about is it all the cardiology we place on the left, or sometimes the second time they will place on the left?
There's a certain situation that there's some difficulty to put on the left side. Then no choice, we still can put on the right side. So there's a possible chances for you to encounter a device actually on the right side. There's a possible chances.
Okay, alright. Thank you, doctor. So ada apa-apa soalan daripada semua pelajar? Ada cikgu-cikgu? Ada tak? Kalau ada sila kemukakan. Tak ada ya? Okay, okay, there's one question ya, ada Ilyas Ryan. Doktor, jika ahli keluarga ada pesakit jantung, adakah saya juga mempunyai risiko penyakit jantung?
Yang ini kena tengok usia dia. Kalau dia masih dalam peringkat remaja, saya rasa jangan risau lagi topik-topik inilah. So kalau dia dah menjangkau usia lebih kurang 30 ke atas, 30, 60, 40 ke atas, dan dia pun dah start menghidapi penyakit-penyakit seperti kencing manis, darah tinggi, dan mungkin kebarangkalian dia untuk dapat penyakit jantung tinggi. Okay, faktor keturunan no doubt mungkin dia sudah ada. So kalau dia sendiri masih ada penyakit dia sendiri, kencing manis, darah tinggi, then the chances memang akan tinggi lah. Yes. So kalau dia masih orang muda, jangan risau topik-topik ini. Maintain a good quality of life, makan elok, okay, dan do a medical check-up, okay, do a medical check-up. Jangan risau terlalu awal. Alright.
Okay, thank you, Dr. Tan. Doctor, one more question from me. Is that gender, male and female? Certain people say certain gender, for example, male more prone to heart attack and female.
Yes. For guys, I think untuk lelaki lah, untuk warga lelaki, saya rasa dah start masuk umur 30 ke atas, digalakkan untuk buat regular body check up setiap tahun, okay? Untuk siapa-siapa pun, orang kaum lelaki, okay? So kaum wanita, faktor risiko untuk dapat penyakit jantung mungkin lewat usia sikit. Sebab perempuan, kalau mereka masih dalam we call it masih kata reproductive age lah, bermaksud mereka masih muda dan masih boleh hamil, selalunya mereka by itself, by nature, mereka akan protect daripada dapat penyakit jantung. So meaning to say that kalau kaum wanita dah masuk usia menopause ke atas, after menopause lah, so mereka punya risiko untuk dapat penyakit jantung sesama kaum lelaki. Okay, lepas menopause, chances untuk mereka dapat serangan jantung setinggi lelaki. Tapi sebelum menopause, sangat-sangat rendah dan jarang berlaku.
Okay, thank you, Doktor. So, ada soalan daripada audience? Kalau tidak, saya rasa kita akan sampai sesi setakat ini saja. Tak ada ya? Okay, kalau tidak, saya mewakili Jawatankuasa Bulan Sabit Merah Malaysia, Cawangan Negeri Pulau Pinang, mengucapkan terima kasih kepada Dr. Tan Kok Leng atas segala ilmu dan nasihat yang amat penting dan berguna sepanjang ceramah pada hari ini. Thank you, Dr. Tan.
Thank you.
Thank you. Diminta semua pelajar jangan tinggalkan platform ini dulu. Pihak JPN akan paparkan QR code kehadiran. Maka semua pelajar perlu ambil kehadiran. Dan satu pengumuman khas, ini adalah untuk ahli bulan sabit saja. Untuk pelajar-pelajar yang bukan bulan sabit, jangan scan QR code ini. Cikgu, sorry, satu lagi, JPN punya attendance. Sekejap ya. Semua pelajar perlu isi kehadiran. Pihak PBSM punya, nanti kamu ada satu QR code yang lain. So pelajar-pelajar bulan sabit perlu standby untuk attendance yang lain, ya. Cikgu dapat tak JPN punya? Tunggu sebentar ya. Okey. Okey, baik. Tadi setelah paparkan senarai kehadiran daripada pihak JPN. So untuk semua yang belum, sila berbuat demikian. Pastikan anda sign your kehadiran anda. So QR code yang seterusnya adalah untuk semua ahli bulan sabit merah. So diminta semua ahli-ahli bulan sabit merah daftarkan QR code ini. Maka kita akan satu sesi iaitu quiz, pertandingan quiz. Hanya terbuka kepada ahli bulan sabit. Cikgu paparkan quiz punya QR code sahaja. Quiz ya. Diminta semua scan QR code ini untuk ambil bahagian dalam pertandingan. Ini dibuka untuk ahli bulan sabit merah sahaja. Ya, ini adalah untuk ahli bulan sabit merah sahaja. Baik, sila scan QR code ini. Kalau sudah scan, tunggu sebentar ya. So on my count, saya akan bilang 1 hingga 10. Maka anda isikan nombor kad pengenalan anda. Anda perlu menjawab 30 soalan dalam masa 15 minit. Okey? Selepas anda habis menjawab, sila tekan klik send dan submit pada Google Form itu. Maka nanti saya akan paparkan QR code untuk anda isi maklumat peribadi. Supaya nanti kita ada pemenang, kita boleh hubungi pemenang dan kita boleh hantar hadiah kepada semua pemenang. Dan ingat juga, semua pelajar yang ambil bahagian, anda akan dapat sijil, ya, sijil kehadiran daripada pihak JPN. So, diminta semua scan QR code. Semua ahli bulan sabit, sila scan QR code ini. Saya bilang 1 hingga 10, maka anda akan mula jawab. Isi IC number dan boleh mula jawab. Setelah habis jawab, klik send. Sebab pertandingan ini dia mengira masa berapa cepat dan berapa soalan yang dapat dijawab. Okey? Bersedia? Saya bilang 1 hingga 10, maka anda akan nampak soalan dipaparkan. Ya? On my count, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, mula. Sila isi IC number, nombor kad pengenalan dan ada dash. Lepas isi, anda boleh mula jawab sekarang. 15 minit kemudian, saya akan tutup Google Form itu. Kalau anda dah jawab, sila hantar serta-merta. Sebab masa juga diambil kira. Ya. Setelah habis jawab, klik hantar serta-merta dan tunggu saya di sini. Nanti saya akan paparkan satu QR code untuk anda isi maklumat secara teliti. Ya, setelah anda jawab, dia ada satu kod. Kalau anda nampak, anda berklik untuk isi maklumat. Kalau anda tak dapat, nanti saya akan paparkan QR code. Anda scan QR code untuk maklumat anda. Okey, anda boleh mula jawab sekarang, 15 minit.
Hello everyone, I am CK Kerr, the founder of Excelife, the top-rated health supplement brand in Malaysia. In 2008, I started to venture into pharmaceutical industry and become a hospital pharmacist. Although I was born in poor family background, but I believe professionalism and creativity are the key factors to succeed. In my career journey, I found out that in Malaysia and Southeast Asia, we are lacking of a series of best ingredients and well-researched health supplements. Finally, with my persistency in year 2018, I have successfully collaborated with world top-rated researchers to formulate a series of self-invented and patented formula. Our scientist partners including the Southern Hemisphere's largest health product researcher, Alpha Laboratories from New Zealand, and the Belgium Research House from University of Leeds Bioextract. This series of health supplements help to solve several important medical problems, including the poor digestive problems, weak immune system in children, and joint arthritis in elderly. With our discovery with the scientists across the globe, our products have been able to reduce the sufferings and medical costs in Malaysians. We market our products and have strong partnership with 250 pharmacy outlets in Malaysia. I lead my team to provide them complimentary training including entrepreneurship, leadership, and soft skills to build their business. Besides that, we collaborated with 10 top-rated universities to inspire more than 3,000 pharmacist undergraduates in Malaysia to serve with great passion to the community that we love. During COVID-19 pandemic, I collaborated with hospitals to organize blood donation campaign to cope with severe shortage of blood to the community. We donate 40,000 worth health supplements to enhance medical frontliners' immune system and to donate PPE, gloves to Hospital Sungai Buloh. We hope to become the driver of healthy lifestyle in the communities that we serve. In the past, we are so honored to win a few important awards. This including JCI CYEA Top 30 and the Star Soba Rising Star. I strive to invent more products to fight against various diseases using natural remedies. I wish my innovative work to advance the future of the medical world and have broad impact to doctors, pharmacists, and patients around the world.
Okey, terima kasih. Semua pelajar 4.30 tepat kita akan tutup pada Google Form itu. So diminta semua pelajar tolong jawab soalan. Setelah habis jawab, sila klik submit, hantar dan maka automatik ada satu link di situ. Klik link itu untuk kehadiran. Sebab waktu pertandingan kita tak ambil maklumat peribadi, cuma isi IC number. Selepas anda jawab habis soalan, klik hantar, dia automatik ada satu link di situ, klik dekat situ untuk isi maklumat peribadi. Mesti isi maklumat peribadi. Kalau tidak, kita tak tahu siapa pemenang. Okey? Saya takut ada setengah dah hantar tetapi terlupa klik pada link itu untuk isi maklumat. Sekarang saya akan paparkan QR code untuk kehadiran. Just in case anda terlupa isi maklumat itu, sekarang saya akan tayangkan QR code. Tolong ambil gambar, screenshot dulu dan ya. Ini adalah kehadiran. Tolong screenshot dulu, nanti baru isi. Screenshot sekarang, lepas tu sambung jawab. Kalau dah habis jawab, anda dapat klik link itu, anda boleh isi melalui link itu ataupun anda nak guna QR code ini. Ya, sebab JPM punya YouTube live akan tamat dalam masa seminit lagi. Ya, diminta semua ambil perhatian ya. Tolong scan dulu, screenshot ini dulu, lepas tu habis jawab baru isi maklumat peribadi. Kalau anda tak screenshot ini, anda boleh klik hantar dan isi maklumat yang dipaparkan dalam link di akhir sekali selepas anda jawab soalan. Okey, akhir sekali saya ingin ucapkan terima kasih kepada pihak JPN dan Excel Live bersama semua ahli-ahli yang membantu untuk menjayakan program ini, Sudden Cardiac Arrest Webinar Sempena Hari Jantung Sedunia. Akhir sekali saya ingin ucapkan semua terima kasih dan selamat menjawab soalan. Terima kasih. Bye.